of the best medical care in all of the United States happens right here in Northeast Ohio.
An annual report released just overnight highlights what local hospital systems have to offer. Our Meg Shaw took a look at that report, and she joins us live this morning to break it all down. Good morning, Meg, and glad to have you back.
Thank you, Danita. Good morning to you and Mike. Good to be back. Well, the Best Hospital Rankings has been around for more than 3 decades. It is there to give people guidance on what facility to choose when they need care. And yet again, the Cleveland Clinic was ranked the 2nd best hospital in the U.S.
Checking into the hospital for an emergency, a surgery, or any other care for that matter can be scary. You want to make sure you or your loved one are receiving the best care possible, especially if you're diagnosed with a specific condition or case. So for more than 30 years, the U.S. News put out a list ranking the best hospitals in the country, plus each state and metro area. The Cleveland Clinic landed itself as the #2 hospital in the nation on the honor roll list and the #1 for cardiology and heart surgery. This is the 27th consecutive year the clinic has earned the #1 ranking for heart care. Diving into the state list, University Hospitals ranked 3rd best in Ohio and ranked 5 in 15 adult specialties across the country. Overall, 224 hospitals in our state were evaluated to determine the rankings. 19 met the annual report's standards. So why rank hospitals? U.S. News says every year about 2 million hospital patients face the possibility of surgery or special care. And these rankings can be used as a tool to help them find sources and skilled inpatient care. But it's important to remember, these rankings should be used as a starting point only, because for most illnesses, patients won't need to go to an honor roll hospital. It's still crucial for patients to do their own research and talk with their doctors, especially if care at one of these hospitals may include travel and lodging expenses in another city, or your insurance's willingness to pay for care in a hospital that's out of network.
All right, so the question about the impact of the pandemic. The U.S. News says these rankings and ratings were all made prior to the start of the pandemic. However, they say in future years they will make some modifications to account for the pandemic's impact. Danita?
Well, Meg, what actually goes into the decision-making process when it comes to the top 20 hospitals on the honor roll?
Well, they look at things like how they did in specialty rankings like cardiology or neurology, and procedure and condition rankings, which include things like back surgery or bypass surgery. They are then given points based on where they fall on those lists to decide how the overall best hospitals in the country. Reporting live, I'm Meg Shaw, News 5.
All right, thank you, Meg.